Attention, all medical staff. Trauma code for children.
For the first time, we gain unprecedented access into Singapore's largest children's intensive care unit.
Series black.
Working in the ICU, even if your feet are paddling furiously underwater, you have to still be able to perform efficiently.
Signs are improving.
Over 22 doctors and nurses work together every day to save children on the brink of death.
Why not me? Why my son?
There is no room for mistakes.
We're intubating the patient.
We are like the gatekeepers. They were the last line in this hospital.
There are no easy decisions.
We may have to let her go.
We reveal the daily fight for survival of these little warriors.
Give me a high five. Send me a high five. Where's your hand?
And the staff who care for them.
You're doing very well. So brave.
This week,
how long is the operation?
Stomach opening alone usually takes me about 2 hours.
3 families watch their young children being put through difficult medical procedures.
When will I know she's very stable and she's successfully extubated? Hard to say.
With no knowing whether their child will survive.
That 45 minutes of waiting is just crazy.
Today, 3-year-old Sinlin will be taken off a ventilator delivering oxygen into her lungs. This procedure is called extubation. But no one knows if Sinlin will be able to breathe on her own after that.
ICU doesn't allow children below 12 years old. This time round, they make an exception. We are able to actually let Sinlin's elder sister to actually come and visit her. In case really this time round she can't make through, at least we still have a chance for them to see each other for a while.
Sinlin has spinal muscular atrophy, a genetic disease that weakens her muscles progressively. Dr. Mok is here to remove the ventilator, which has been Sinlin's lifeline for the last 2 weeks.
Before I go ahead and extubate her, 我是要再想跟爸爸妈妈再 confirm 一下子 after extubation what are some of the things that we want to do. When will I know she's very stable and she's successfully extubated? Hard to say. In her case, I'm going to say 24 48 hours. Worst case scenario is I take out the tube and she just kind of she starts to turn blue very quickly and she looks very uncomfortable. Then I'm going to say at this point there's nothing more I can do short of re-intubating her. And Daddy and Mommy feel that no, then my recommendation is then we start the morphine to make her feel comfortable. The morphine primarily is to make her not feel uncomfortable with the fact that her oxygen levels are low. Right? So you and I now, when we normally have low oxygen levels, we struggle to breathe. It's almost, we feel a bit suffocated. And what we're trying to do is take away that sensation so at least she feels comfortable. Any conversation talking to parents about how do you want your child to die is never an easy one.
Sinlin's parents have faced this decision before. Previously, they chose to put her back on the ventilator if she failed to breathe on her own. But this time, they don't want to prolong her suffering. If she fails to breathe on her own after the extubation, Her parents have decided not to put her back on the ventilator.
Stand here to make sure you're okay with it.
No, mommy, daddy, you're just scared. That's okay.
Cannot cry, okay?
I will take out this mask. Be uncomfortable, okay? Sorry, The minute we extubate, I want the mask on. Okay. Good girl.
But a day after the extubation,
Her A&3 is a bit worse than yesterday afternoon. Yesterday afternoon, I think after she sort of stabilized a bit, we actually heard quite nice, not bad breath sounds going through. Today, not so good. I only hear maybe a little bit on top here, very little on the bottom area. So it's like open this way.
Sin Lin's lungs are filled with mucus, which are blocking her airways.
It sounds like she's plugged up the
One side.
right side.
The doctors face an impossible dilemma: suction her and temporarily cut off her oxygen support, or do nothing and allow mucus to choke her air passage.
We will have to suction the oral cavity, no choice about it. Because if the secretions are there, we need to get it out. Otherwise, this mask there also no point. But the problem is every time I suction, I don't know how she will respond to the suction.
The conclusion is optimistic or pessimistic?
Unknown. Unknown.
How long is it?
Don't know. If this, because now really depend on her secretion and her strength.
The doctors decided they can't put off the suctioning any longer. They need to remove the mucus blocking her airways. Senior resident Dr. Sudipta is standing by with a bag to resuscitate Sin Lin.
I do the mouth first.
Okay, darling, just a little bit, okay?
No, a lot, Very, very good. Okay? Do your nose.
Okay? Okay. On your palm.
Okay. Go back for what? Finish? Yeah, fine.
The physiotherapists and doctors managed to successfully clear the secretions for now. But Sin Lin is not out of danger.
During the oral suctioning, actually the child desaturated to 90% and needed bagging for about 5 minutes. So her heart rate was still in the high 160s, 170s during the episode.
Sin Lin requires suctioning every 3 hours. And every round of suctioning poses a risk to her life. Ding Shan and his wife are too anxious to leave Sin Lin's bedside. Tonight, they will be keeping a vigil in the hospital.
Marcus, no, stop, don't pout. Listen, I need to tell you something. Look, listen to me. Hey, I'm telling you good things. Hello, open your eyes.
9-year-old Marcus had a sudden viral attack on his heart.
Yeah. Okay, so you cannot be moody, okay? You must listen to us. Listen to us. Promise? Good.
For days, he has been kept alive on a heart bypass machine called ECMO that helps pump blood around his body.
Water. Okay. Oh wow. I know this Pokor very naughty. Always feed you water. A lot of water.
I am the good guy.
Apparently you give him the water, then choke, okay?
No, I only give him 5-10 minutes at a time.
After days in paralysis, Marcus's incessant request for water shows that he has regained much of his energy.
We assessed Marcus today, and his heart function actually is continued to show improvements, and his heart rhythm is actually very stable now with the medications that we're treating him with.
Marcus, I'm going to scan your heart. All right? I'm going to turn towards me. Get cold, is it? Okay, we're going to keep you wrapped up first, okay?
But Marcus is not in the clear. Being on the ECMO has put Marcus at risk of developing blood clots, which could cause a stroke or heart attack.
Marcus, the gel is going to be a little bit cold, okay?
He is now on blood thinners, which may have contributed to bleeding in his lungs.
The right side is breathing very well. The left side is still down, but definitely better.
I think we can go ahead and probably take the breathing tube. If not today, then maybe tomorrow or the day after.
I think that's the only thing he wants. For me, it's the ECMO out, ECMO out.
Yeah, but he's like, give me water.
Everybody is like, now Marcus Water Toe already.
Yes.
His middle name is Water. Oh, Lollipop.
Lollipop, I said lollipop can. Okay, come and see.
Marcus has not yet recovered 100% of his heart function. But the doctors decide that it is too risky to keep him on the ECMO machine.
Good job, Marcus. I'm so proud of you. I'm really so happy, okay?
But coming off ECMO means removing two very large tubes that are stuck into blood vessels in Marcus's neck. It's a simple procedure, but it's a very risky one.
When we remove tubes from blood vessels and there are clots within it, there's a potential risk that we dislodge those clots and they may travel to the rest of the body, including the brain, or the blood vessels supplying your heart, in which case you get a stroke or you get a heart attack essentially.
Mommy say bye-bye for shop. Okay.
Mommy wait for you outside, okay? Good job. Good job.
Okay.
Inside the OT room now.
Bye-bye. Bye-bye. Dah, tinggal come, okay? So when you wake up later, you will come ready. Don't cry anymore. You're stronger, kan? It's not your first time, kan? It's okay lah. Don't be scared. Okay, don't be scared, okay?
Shikim is preparing to send her cancer-stricken child, 3-year-old Alia, in for an invasive stoma surgery.
Let me wait for you.
The main risk of opening the stoma, i.e. the operation tomorrow, general anesthesia, bleeding, which we have to give a lot of blood product to make sure that she can clot very well to minimize the risk of bleeding. The bleeding risk is real.
Because of her leukemia, Alia's blood count and clotting function is low, which put her at great risk of blood loss and death. But Alia's mom, Shikin, has chosen to take the risk. In exchange for a faster recovery from a gut infection that could also turn deadly for Alia.
I'm quite worried because like ICU is like more like intensive, intensive units.
Nearly an hour later, Marcus's operation is still underway.
We're waking him up and see how it goes. But I can't remove whole clothes. I just flush out by blood. So we'll just see how it goes.
Dr. Nakao had to come out and explain to me that, there were a bit of blood clots, and he was having a little bit of worry of having a stroke in the brain. We can only find out when Marcus awakes and check his neural state. That 45 minutes of waiting is just crazy.
Marcus has gone through an operation to remove him from an external heart bypass machine.
Yeah.
45 minutes after the surgery, Marcus finally comes to. But the doctors don't know if he has suffered a stroke as a result of the operation. If Marcus can move and talk, he's in the clear.
Jaja is coming to do therapy for you, okay? A little bit of therapy, just a little bit. Water. Okay, coming.
Are you cold? Cold, Mommy. Cold for you first week.
Baby, but we cannot drink too much, just a little bit to rinse your mouth. Okay?
Good job, Marcus, okay?
As Marcus woke up and we assessed him, he was back to his usual self. He was chatting with us in a way that we were quite happy that there was no major complications from the procedure or from the blood clots that were within his blood vessels.
Okay, Mommy, put a bit for you, okay?
I'll just be here.
It's like God has given me a second chance to care for him again. So, I should be very happy, and I am very happy that I have an opportunity to be taking care of him again.
Alia's procedure was supposed to take just 2 hours. But the operation is taking much longer.
But this case I can only do with one instrument because we don't want to open another wound. So it's something like operating with only one hand, which I usually can do 2 hands.
Where's Mommy? Maybe here. Don't cry, huh? No need to stand, no need. Mommy's here. Just lie down. Sure, Mommy's here. Yay, Mommy's here. Mommy, yeah. Wait, huh?
Okay, done. Finish, Dr. Jessie. Okay, done. It's done.
Shikin is hopeful that the operation will pay off. It creates a stoma bag for Alia, which collects stools from her intestines, thus bypassing an infectious wound in the anus, so it could heal faster.
Finish already, right? Stronger, right? Stronger, kan? Pain? Is it pain? Is it pain? Oh, no pain. Pain or not pain? No, okay. No pain. Okay, no pain, good lah. No water not? Later I give you water. I hope it.
Let me just check whether it's okay.
You mean the stoma, is it? Oh, something like that.
So it should be okay. So now no breathing.
Okay.
You just take a look from time to time.
Okay.
In case breathing, you keep it like that.
Alright, sure. Hopefully there's no any complication of infection and so on. Yeah, just hoping that the swell is going down and it's all back to normal. You're very good. Very good. We're so proud of you. You're not scared, right? You're brave girl, kan? Is it you brave girl? Yes.
The worst is over for Alia. But not for Sin Lin. After she was removed from life support, Her oxygen level starts plummeting. Her heart is beating abnormally fast, a sign that she is in distress.
Her lips started turning pale, and my wife was like telling me that she started to feel her hands and legs started to be very cold. So we thought we were going to lose her at a point of time. So,
doctors decide to inject Sinlin with morphine to keep her comfortable.
She was still really looking around. That's why they asked her if you like explain to them it's really just
Maybe we're going to another hospital far away. Okay? Sick, maybe very sick, okay?
Fraser?
Tell me I love you. Tell me I love you. You're always in my heart. You're always in my heart. Okay?
In my years working in the intensive care unit, the hardest lesson has been about letting go. I think all of us started in our medical journey wanting to cure, wanting to fix something. But I think technology and science is finite. There's some things that we have no control over. It's about the realization of saying when enough is enough. When is any further intervention just going to cause more harm, more pain, more suffering to my patients and their families?
Okay, 1, 2, 3. Okay.
we wanted to actually carry her for the last, so-called the last time. At that point in time, we just want to stay by her side.